Professor Jackson here, and today we're going to begin our study of the bone in preparation for lab exam number 2. So as you can see here, I've got the updated study guide, and basically this organizes it slightly differently than the lab sheets. All the exact same terms are on this sheet. The difference is I put things that are foramina and canals, different holes together, and things that would be some kind of projection, things that would stick out together, particularly on the skull. So it's slightly reorganized, but it has all the same features, so you can feel free to study with either sheet, whichever one is easiest for you. We're going to begin with the actual skull, go through the major bones, the cranial bones and the facial bones, go through the cranial sutures, and then go into the specific features, the ones that are projections as well as the ones that are various types of foramina and different holes and indentions into the skull. Then we'll talk about the sinuses and move on to the comparable fetal skull. All right, so I have one of our skull models here, and I've included the mandible. Obviously, the mandible comes off, and in all our models, we can also detach the most superior portion of the cranium of the head. A few major terms to remember. Obviously, these are teeth right in here, and this is where the nasal passages would be. These are the orbits on either side where the eyes sit. And the better you know some of the vocabulary, the easier it's going to be to notice some of the specific features. So make sure you go back to your book and look at that table of features. What things are different types of canals? What are projections what are bony processes? What are projections that are designed for muscles to attach? And it'll make it a lot easier as you try to study. So first, the major bones. The first bone is the frontal bone. This is roughly the forehead. It sits in this area. And the division of the bones in the skull we can see for the major bones by way of a suture. So this is the coronal suture. You can think of the word crown. Our word crown in English comes from the same Latin word that coronal does. So frontal bone and coronal suture, which separates the frontal bone from the parietal bones. Okay, there is a left parietal bone and a right parietal bone. And this is divided by the sagittal suture. And that's easy to remember because it sits right along the mid-sagittal plane. Then if we turn the skull to the side, right about where the little points of attachment are, on most of these skulls you can't really see the suture very well, so it's actually drawn in on some of them. But basically there's part of the suture right there. This is the squamous suture, and the squamous suture separates the parietal bone on either side from the temporal bone, which is where we get the term temples. The temporal bone is this area and also includes this process that sticks out. So we have, this is the right temporal bone. If we flip the skull over, we can also see the left temporal bone in this same general area, and you can kind of see parts of that suture. Then if we turn to the most posterior section of the skull and the inferior section of the skull, basically all around this large hole, the foramen magnum, which we'll talk about in a minute, we have the occipital bone. So it's this back section here and working our way towards the back of the skull. The occipital bone is separated from the two parietal bones right here by the lambdoid suture. So that's the lambdoid suture right there. All right, we're going to go ahead and, before we get into the facial bones, we're going to look at some of these same bones in the fetal skull. Now, we don't have very many of these in the lab, but as you can see, the fetal skull is not fully closed. Okay, we have this, what we call a soft spot or a fontanelle. And so there's two fontanelles that are a little bit different. On this fetal skull, we can still see where the frontal bone is, right here. And you can see it's actually separated into two pieces. We can see the parietal bone on either side. If we look near the back, we can see the occipital bone. And what would basically be the formation of the lambdoid suture coming in with the sagittal suture is actually a fontanelle as well. So this is the posterior fontanelle near the back of the skull. And this large one in the front is the anterior fontanelle, where the frontal bone and the two parietal bones will come together. Now we can also find the temporal bone on the side, and you can actually see the suture a little bit better in this this fetus model. Same here, there's a temporal bone. And then we also have the mandible, which as you can see is not attached. I left off the mandible on the little model here when I picked it up. But the mandible is another word for the jaw, so let's look back at the adult skeleton. So the mandible, one of those facial bones. It's the only facial bone that is detached and can move. We'll talk about the temporomandibular joint, or TMJ, in the joint chapter, but that's the mandible right here. All right, Moving on to the other facial bones, in addition to the mandible, if we work our way up, we have the maxilla, which is the upper formation of where the teeth attach. This is the maxilla, or two maxillary bones, one on either side. We have one mandible, but two maxillae, or two maxillary bones. All right, and then we have on the side, the zygomatic bone. Okay, this is another way of saying the cheekbone. There's a zygomatic bone on either side, right here, just below the orbits, just below the eyes. We have the lacrimal bones on either side. You can see this little foramen or hole right there. The flat surface around there is the lacrimal bone on either side. That's where your tear ducts sit. Your lacrimal ducts are your tear ducts. So they sit against your lacrimal bone. And then we have nasal bones. Okay. We can see the nasal bones essentially right here. This upper portion connecting in towards the frontal bone. That's the nasal bone where my thumb is pointing. And then we have, if we flip the skull upside down, we can see the palatine bone and the vomer. All right, so remember, this is the occipital bone here, just below the foramen magnum. Coming in on either side here and here, where this finger are pointing, we have the bottom of the temporal bone. All right, and those are going to articulate and come in near the sphenoid bone, which is right here. We'll look at that on the inside in a second. And then right where we have this little V feature, okay, right where the nostrils come in, we can see this V feature is the vomer bone. Sometimes it almost looks like a W, so right here. And then on the top surface of the mouth, we sometimes call this the palate. And so this lower portion right where my finger is, where this little projection sticks out, is called the palatine bone. And this is part of the maxilla, or the maxillary bone. So the palatine bone is this back portion, more posterior, and the maxilla or maxillary bones are this more anterior portion, right by the teeth. All right, let's open up this skull and look at the bones inside of the skull. All right, so this is the frontal bone right here. We're just deep just inside of the forehead, so the frontal bone. We have the occipital bone down here. So again, I'm looking at the lower portion. I just slid the cap right off. So occipital bone right in here. We're going to see along the sides, we're actually going to be able to see the edges of the temporal bone. And then there's a bone that's fairly deep. It's called the sphenoid bone, and it's right here. So the frontal bone, the temporal bone, and the occipital bone. Then this is the sphenoid bone. The sphenoid bone is sometimes called the keystone because kind of like when you build an arch, you have to have that top stone to hold everything in place. This is the keystone bone of the skull that holds everything in place. All the major bones of the skull articulate with the sphenoid bone. Sometimes we call it the bat bone because it looks like it's got wings. And in fact, we call this the lesser wings, these little pointed areas here and here. And then the greater wings are basically this portion just below. So lesser wings, greater wings. We'll talk about that when we get to the features in just a minute. And then the last bone is the ethmoid bone, right here in the center. That's that little projection that sticks up in between, it's medial to the two sections of the frontal bone. All right, so frontal bone, ethmoid bone, sphenoid bone, temporal bone on either side, occipital bone. And those are the deep features of the skull. Going back to the outside, okay? So this was the frontal bone that we were just looking at towards the forehead. That's the anterior direction, so the frontal bone. The two parietal bones separated by the sagittal suture. And then here this is the coronal suture. So we work our way posterior. We see now coming into focus is the lambdoid suture, and just near the back there we have the occipital bone, the most posterior and inferior bone there in the skull. And then on the side, near where those hooks are, we have the temporal bone, and that works its way all the way down towards that large zygomatic process right here. Okay? Then we have the zygomatic bone. Okay? Again, this is the frontal bone right here. The zygomatic bone. The nasal bone. All right? The maxillary bones, or the maxilla, on either side. The lacrimal bone right there, that little surface near where the little foramen is. On the bottom, we have the palatine bone right here. This is the maxilla, or the maxillary bone. This is the palatine bone. The sphenoid bone is going to be this whole area right in here. Right where my thumb is, where the V is near the bottom, that would be the vomer. Sometimes we call it a plow shape. And then we have on either side the lower section of the temporal bone. And then, of course, back here we have the occipital bone.